or you could go, depending on your region and your district clinical rotations, it could be a smaller hospital or regional hospital for you to get your adult health 1 clinical rotations done. As you can see here, I made sure I listed based on Brittany's information. Again, I'm gonna reference her video. When you go to adult health 1, you're looking at working 3 12-hour shifts in 1 week, and then it's within a 3-week period. So the first week you would work 3 12-hour shifts. You might be off that second week, and then the third week you work 3 12-hour shifts. Now, you won't find out if it's days or nights until 3 weeks prior to you going to your clinical rotation. So 3 weeks or a month prior to you going to your clinical rotation, you will get your schedule. So you can work things out with your manager. If you own your own business, you can work things out with your clients. But yes, it would be you doing 3 12-hour shifts 1 week and 3 12-hour shifts the second week within the 3-week period. And as you can see, that's a total of 72 clinical hours for the adult health 1. And if we keep going here, once you get out of your second term with WGU, then you go into your third term at WGU, but that again is the second term of the nursing cohort. That's the best way I can put that. So we have after another 6 months, right? So we're in this third 6 months that we've been at WGU, following this cycle here, and that would be considered almost a year, right? So for me, that would be October 1st of 2026. I would be going into my intermediate nursing skills, which again is 4 days in person at my region's lab simulation center. And then after I finish that and I pass everything, then I would get into adult health 2. And as you can see, adult health 2 would be the same thing, 6 12-hour shifts within a 3-week period. Okay. Then also in that same term, after I finish that, and I think that is truly like a hospital med surg adult health 2, if I'm not mistaken. But after I finish that, then I go into women's and children's nursing, and that is 5 12-hour shifts within a 3-week period. So you would be attending that hospital or that preceptor, following that preceptor for 5 12-hour shifts for women and children. Then, you complete this. This is a paper-based type of class. Once you complete everything and you get everything ready to go, you're now entering, for me, that would be April 2027. I would be entering my 4th term at WGU, and it would be mental health nursing. As you can see, I will do 4 12-hour shifts. And then I would do another 4 12-hour shifts in a community health where I believe you get a list, or you approach your mentor and your clinical instructor on what community health opportunities you may have in your area, based on their list, right? Based on the list that they provide. So you can select that and decide. I think Brittany made a comment on one of her videos that she did 2 12-hour shifts at like a food bank, and then the other 2 12-hour shifts at a addiction center, like a rehab addiction center. So you can decide what your community health, based on the list that's given, what you're going to select. And then, like I said, it would be 4 12-hour shifts within a 3-week period. Okay. And then as you're approaching your final term with WGU, and your final term, of course, of the nursing, as you can see here for adult health 3, we'll go with the standard of 6 12-hour shifts. And that should be the more advanced. You also see here that you have advanced skills lab. That is a virtual lab. And there, it's like a simulation that they would give you. I believe you communicate with your instructor, like doing a debriefing and then a offboarding briefing. I can't remember what the second one is called. I know the initial is the debriefing with your clinical instructor, and then she somewhat just check your assessments and all of that virtually. And so that's what the final term you would do. But I definitely want to get into this nursing role transition course. As you can see, it's going to be 11 consecutive 12-hour shifts within a 5-week period.